Topic is lens tissue forceps. So, dear students, we'll discuss an instrument today. So, what is this instrument? Is see that finger bows are there, ratchet is there, lock is there, and there's a curvature here, and there's an opening here, fenestra, and the opposing teeth, fenestra, curvature, opposing tooth are here, like this, tooth are there, opposing tooth like this. So curvature is there, very stout instrument. So what is this instrument is? It's a lens tissue holding forceps, often kept in your oxy and viva. They will ask. It is hold tough structures like aponeurosis, fascias, rectus sheath, and so on. Especially in gynecology, they use it, and we also use it. And often it is used to hold the lymph node during lymph node dissection, and bulk structures can be held. And it got a tip, so it grafts very well, and it won't get slipped off because of the tip tooth in the tip. So it won't get slipped off. So it holds very strong instrument. It holds very well, especially rectus sheath, tough structure, aponeurosis. It retains very well. Hold and tie it and put it away. And very useful instrument that is lens tissue holding forceps. Similar instrument, at least olden days, we used to use is Moran Baker's appendix holding forceps. Similar like lens, but there are few transverse serrations in just proximal to the tip, like this. Tooth will be there, proximal few serrations are there. So that is not lens. That is Moran Baker's appendix, specifically appendix holding forceps. Now it is commonly not used, but olden days it was the instrument to hold the appendix. Now we use commonly Babcock's forceps to hold the appendix. So Moran Baker's instrument, appendix holding forceps and lens tissue holding forceps look similar, but in lens there are no serrations proximal to the tooth. Whereas in Moran Baker, there are serrations proximal to. That's the difference. If they keep both instruments, then you should see open and see how to identify, say, whether serrations are there or not. So that is lens tissue holding forces. Go through my clinical methods in surgery and manual of surgery instrument topic. Everything is given in detail for your knowledge purpose. It is an oxy definitely kept in the exam. So you should know this instrument, very commonly used instrument in surgery, gynecology, orthopedic, or surgical field. So students, again a request to subscribe my YouTube channel and share with your friends and colleagues. So daily 5 to 10 minute lectures are very useful. Upgrade your surgical knowledge in easier way with the 2 MCQs and quotations will be helpful to understand and your surgical knowledge. Because daily day-to-day basis. Also, we'll have a sessions, live session once in 2 weeks or a week, wherein student will present a case. So 1.5 hours live session discussions, introduction session, not only with me, with the senior professors around, so that you can put your questions, queries in the chat box and get the proper answer. And join that will be very, very useful for your practical exam, because case discussion it is. And also, you will get a certificate if you join the live session. It will be again useful for your future career. So again, a request to subscribe my YouTube channel. Student, answer the MCQ and put the right answer in the comment box. I will acknowledge your answer. So identify this instrument, A, B, C, D, put the right answer in the comment box. And again answer what is the most likely clinical diagnosis. There are so many possibilities are there, but what is the most likely clinical diagnosis? Look at this, which is the spotter. What is the most likely clinical diagnosis in this patient? So A, B, C, D, put the right answer in your comment box. We'll get back to you. Quotation of the day is, God never promised us an easy journey. He only promised us a great destination. So don't expect God to give everything. He will just give a guidance to reach a destination. So whatever you want. So that guidance from the God is important rather than everything. You have to earn whatever you want to be, but the guidance and great future destination will be given by the God. That's what exactly meaning of this quotation. Again, students, please subscribe my YouTube channel, share with your friends, upgrade your surgical knowledge, in live sessions. So students, I hope you have understood that lecture very well. Thank you so much.